Hello everyone, my name is Sherifat Abdusalam. I have my badge on. I'll be performing ophthalmic medication administration today. First, I've gathered my supply. I have gloves, I have washed clothes, I have the medication, and then I have my makeshift receptacle for trash. I'll verify the doctor's order. It's for Timolol 0.25%, solution 1 GTT in each eye BID, which is twice a day. This order I'm going to verify using the 6 rights of drug administration, which is the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I'm going to check if there is any known allergy for the patient. Then I'll proceed and go to the EHR, which I'm going to compare the order I have in hand with what is in the EHR. The order states Timolol 0.25%, Timolol 0.25% solution 1 GTT in each eye BID, which is twice a day and is in each eye. So I'm going to confirm that with the EHR. Once I've been able to do that, I'm going to gather all my supply. I'm going to the patient's room. Knock, knock. Hello, my name is Sherifat. I'm going to be your nurse today. I'm going to close the door to provide privacy. If for any reason the patient have family around, I'm going to ask the patient if they want the family to be around when I administer the medication. If they say, if I'm doing this because I don't want to have any EPA violation issue, that's why I'm doing that. I'm going to ask the patient then if for their name and date of birth, identify them 2 ways, and I'm going to verify that with the wristband. Once I do that, I'll ask them again if they have any known allergies so as to compare to what I have in the EHR. Once that is done, I'm going to explain the procedure to the patient. Mr. Smith, I'm here based on doctor's order to administer Timolol eye drop for you. It works by reducing eye pressure, and it is used to treat glaucoma and any other eye pressure issue. It has some side effects, which can be stinging, some burning, irritation in the eye. You may actually feel that when I instill it into your eye. If you do feel some burning sensation or irritation, please let me know. The medication also has some adverse effects such as dizziness, fatigue, hypotension, heart failure, some coughing, shortness of breath. If you experience that, please let us know. Use the call bell light to notify staff. Do you have any question? If the patient says they don't have any question, I'll proceed. If the patient say they want to self-administer and instill the medication themselves, I will allow that because it's allowed. It just has to be done under a nurse's supervision. Once once that is done, I'll also if the patient is receiving my drastic medication, I'll let them know that the side effect of that will be light sensitivity and some blurry vision. Then once this is done, I'm going to proceed by wearing gloves. At this point, I'm going to help the patient into a comfortable position. The preferred position is supine, but if the patient is seated, I want them to have they are like seated on the chair. I want them to have their neck slightly hyperextended so that it will be easy to administer the medication. I'll also check to see that the bed is raised up to a comfortable position and that the rails are also down. Prior to administering the medication, I'll have to wash away any drainage or crust on the eye. This I'm going to do by taking the washcloth. The washcloth is already pre-moistened and warmed up. So I'll take the washcloth and I'll use it and apply gentle pressure on the eye, holding the warm down cloth over the eye. I can also use a cotton ball. I'm going to place it over the eye for like a minute or two, and this is because I want it to soak the cross so it's easy to wipe one time. So once that is done, I'm going to wipe the eye. I'm not putting any pressure. It's a gentle placement of washcloth. Then I'm going to clean from inner contours to the outer contours. When that is done, I'm going to flip the washcloth. Go through the same process. Gently apply the washcloth over the eye for a couple of seconds. Wash inner to outside contours. Once that is done, I'll place in a trash. I will not scrub the eyelids. I'll then remove my gloves, perform another hand hygiene, and wear another glove in preparation for administration proper. Once this is done, I'll open the eye drop, remove the cap from it, place it, and then with my non-dominant hand, I'm going to take another washcloth, fold neatly, and I'm going to start on that side because it's closer to the camera. So I'm going to use my non-dominant hand, gently place the washcloth on the cheekbone, and I'm going to apply a little pressure. And the reason for applying this is because I'm going to use that's the cheekbone. I'm going to use my forefinger to do that. I'm going to press down with my forefinger against the bony orbit on the cheekbone, and this is because I want the conjunctival side to be exposed. I'm not going to press directly, and I'm doing all that because, like I said, to expose the conjunctiva so that the eyedropper can go directly into the sac. And then at this point, I'm going to ask the patient to look up and then look at the ceiling. And then I'm going to place the medication over their eyes with the eyedropper approximately 1 to 2 centimeters above the conjunctival sac, or half to 3/4 inches above ground, and then place 1 drop inside the sac directly. I'm not pressing against the wall. Once that is done, I'm going to apply that process on the other side. If for any reason while I'm addressing the patient closed their eyelids or it dropped outside the conjunctival sac, I'm going to repeat the procedure. Once that is done, I'm going to take that, switch the washcloth, the same process, press gently on the cheekbone, pull down, look at the conjunctival side, sac, let it open, place the eyedropper 1 to 2 centimeters above it, and then drop. The order says 1 drop, so it's only 1 drop that will be administered into each eye, 1 each. Once that is done, I'm going to place that washcloth in the trash, close the medication for the patient, and then at this point I'm going to ask the patient to gently close their eyes and move it slightly for the medication to actually be well absorbed. If the medication, the other thing I'm going to do is to use the nasocremal duct, which is the tear duct. I'm going to place the washcloth over it just to make sure whatever fluid or liquid that is draining off the eye, it's okay. I'm not putting any pressure. I am just and I'm using a new washcloth for that. I am just using that to soak up any other excess medication. And then if the patient is using any other medication that requires them to have eye patches on the eye, this is the time that I'm going to apply the eye patch in the eye, and I'm going to use tape to tape above the not on the eyebrow, above the eyebrow, put one tape over it, so as to, because some medication others can have some light sensitivity that the order says to protect the eye. So once that is done, I'm going to take the washcloth that is dirty. I'm going to put it in the trash, and like I explained earlier, the nasocranial duct will be covered up just to soak up any other eye. And then I've already asked the patient to close their eyes and roll gently for further absorption of the medication. At this point, the medication administration is complete. I'm going to remove my dirty gloves, and I'm going to perform another hand hygiene. So once I've done that, I put that in the trash. Once that is done, I'm going to place the patient back in a comfortable position. Let them be seated. Are you okay? Do you have any burning sensation, any irritation? If the patient have any concern, at that point I'm going to address. If they say no, I'm going to also explain to them that they should notify staff if they have any burning sensation, any irritation, or feel any shortness of breath, whatever side effect or adverse effect that they may experience. And then I'm going to put the call light close to them, arrange the room, make sure the whole setting is appropriate, the bed is appropriate level, the rails are up, the headrest is in a comfortable position for the patient. Mr. Smith, I'll be exiting the room now. If you have any question or concern, please let me know. I'm going to check you again in 30 minutes. At this point, the medication administration is complete. I'm going to gather all my supplies. I'm going to leave the room. I'm going to, I've taken all the supplies, leave the room, and I'm going to perform documentation. Thank you.